Welcome to FDA's Quality Breakdown. I'm your host, Devon Edwards. Welcome back to another edition of Quality Breakdown. I want to start off with some more good news. On my behest, this podcast has been reformulated to be packed with even more goodness. Yes, it is now bursting at the seams. I'm proud to announce that Quality Breakdown is now reformulated to be fat and cholesterol free. So go ahead, consume all you want. So before we get started, I just want to ask that you take the time to like and share this podcast. Why? Because we appreciate it and it costs you nothing. One thing I've noticed is there are so many opportunities to learn from the mistake of others in the world of pharma. But what I've learned over the last 35 years is that not only do those lessons play on a repetitious loop, many times they're repeated by the same people. So here are 3 lessons that I would like you to consider so that if we do not end it, we at least see a decrease in these issues. Okay, let's do a quality breakdown. Repeat warning letters. That's right, repeat warning letters, not repeat 483s. Repeat warning letters. Now, as an example, let's look at Caraco. This company began receiving poor FDA inspections as early as the year 2000. In fact, they received another inspection in 2001, resulting in 17 483 observations. Now, that was followed by yet another warning letter in 2002. Then they received a 22 observation FDA 483 in 2006. This was followed by multiple recalls. And then their consultants did an assessment and told them that severe FDA action was extremely likely. Their response? They said the consultant was being an alarmist. The consultant said, "This is bad. I believe the FDA is going to do something pretty dramatic. And more likely, you're going to get your products seized." They said they hadn't seen seizures happening in the industry. Several bad inspections later, and the company went into a consent decree. But they probably finally learned their lesson. I think. Maybe not. Looks like they didn't. Oh boy, seems like they're permanently closed. So where's the quality breakdown? I have stated this many times over the years. Actions over time become habits. And habits over time become culture. People are creatures of habit, and poor habits can become addictive. Once you have a culture of lax GMPs and ridiculous behavior, there will be a constant struggle to survive for regulatory oversight. Just ask Caraco. Oh, that's right. I keep forgetting they're closed. Lesson number 2. In a lot of companies, quality is considered the enemy. That is until FDA arrives. The least likely area for capital investment is in the area that can permanently shut the doors. That's right, the quality unit. And as soon as the FDA arrives, quality becomes the prom queen. And as soon as the FDA leaves a damning 483 or a warning letter, suddenly there's a rush to invest and fortify the quality department. Now, that revolving door never stops spinning. Here's a heads up. When you have a production person repeat that quality is not a profit center, understand that there is no profit center without quality. None. Not in our industry. Fail at quality and watch how quickly capital flies out the window and into the toilet. Recalls, lawsuits, lost customers, bankruptcy. Don't believe me? Ask these guys. Lesson number 3. You can never assume that all is well just because the surface looks clean. world of sins can be happening underneath the surface. If you contract out services or materials, don't assume that the glossy pamphlet, the sales pitches, and the promotional material is reality. Some years ago, I traveled to Europe on a due diligence audit of a potential supplier. I was tipped off that the supplier had ghost manufacturers and labs spread out across Asia. And while the site looked pristine and organized, I did get confirmation that they were actually doing this subcontracting to ghost sites. And that was so that they could maximize their profits. You see, they could get cheap materials, fake a certificate of analysis, and sell material at a highly marked up price. Here's what they showed me at the first site. And here's what was lurking in the ghost manufacturing sites where the material was actually being made. And yes, if you thought you saw a hollowed out bombshell being used as manufacturing equipment, you are right. So key takeaways. Number 1, develop a quality culture or you will continually struggle with regulatory oversight. It's a losing game, so don't play it. Number 2, recognize quality and appreciate the fact that they are the ones that keeps the profits flowing. Number 3, it's okay to trust, but make sure you verify. Get eyes on your vendors and supplier operations. After all, you are ultimately responsible. I want to thank each of you for tuning in to Quality Breakdown. I know this was a quick one, and I think you appreciate that. If you need any compliance assistance, FDA can help. If you would like regulatory consultation, this includes GMP training, 483 remediation, mock FDA inspections, certification training, and much more. Contact fda.org. If you would like to contribute to the development of this podcast, donations are accepted through Cash App at $Enterprise Endeavor. I always recommend having a professional consultant help navigate you through the regulatory channels. There are many qualified consultants, and I always place former FDA field investigators at the top of that list. But if you cannot get a former FDA investigator, FDA has created audit tools that are like nothing else out there. These tools are in the form of ebooks, but they were created with the input of former FDA investigators. Each ebook not only tells your auditor what to review, tells them how to go about performing that review and common problems that the FDA finds. Nowhere will you find this type of assistance. These audit tools are specific to clinical audits, oral solid dose, and APIs, the ultimate audit tools. All are available on Amazon.